for 26-27 financial year. We are confident that this funding will strengthen forensic and primary mental health services through the appointment of additional mental health professionals and district facility levels. This will improve access to care, treatment and rehabilitation across the province. On HIV, TB and AIDS, Honorable Chairperson, while KwaZulu-Natal continues to carry one of the country's highest HIV burden, it is also demonstrating what can be achieved through science, strong partnership and the dedication of our healthcare workers. We now have 98% of our people who know their HIV status, 87% on treatment, and 85% of them have achieved viral suppression. 5 of our 11 districts now rank among the country's top performing HIV districts. These are Zululand, Herikwala, Umkanyagute, Uku, and Utugela districts. Additionally, eThekwini, King Cetshwayo, and Umzinyathi and Umgungundlovu put us in the country's top 15 districts that are doing well, while Ilembe and Amajuba are ranked at position 17 and 33 respectively. We are also encouraged, Chair, by the success of our Close the Gap campaign. We have managed to exceed our target by tracing and bringing people back into HIV care, successfully re-engaging more than 210,000 clients against a target of more than 116,000. However, too many patients still continue to fall out of care. As a result, the province recorded a net increase of just over 15,000 patients on HIV treatment, leaving a remaining gap of approximately 101,000 people to be retained in care. In response, the National Department of Health has extended the Close the Gap campaign on finding people who are lost to HIV treatment until December 2026. At the same time, we continue expanding access to HIV prevention through PrEP, voluntary medical male circumcision, HIV counseling and testing, and community-based screening, ensuring that our response remains patient-centered, accessible, and focused on ending HIV as a public health threat. Chairperson, as we strengthen our HIV prevention program, we are encouraged by scientific breakthroughs, such as those that gave us the lenacapavir injectable, or simply what is called in the province, Ulena. Administered just twice a year, this long-acting injectable HIV prevention medicine is widely regarded as one of the most significant advances in HIV prevention in decades. It offers a highly effective and more convenient option, particularly for young people and those who struggle to take a daily HIV prevention pill. Its introduction in June this year has generated significant optimism and excitement across our province. From the 12,000 doses of Ulena that KwaZulu-Natal received from National Department of Health, we have already enrolled more than 6,000 people who are now enjoying its benefit. On voluntary medical male circumcision, Chair, we wish to reiterate that this program has been scientifically proven to reduce the risk of HIV acquisition by up to 60% in men. It also contributes to better genital hygiene and reduces the risk of certain sexually transmitted infections. It remains a critical component of our comprehensive HIV prevention program. As the KZN Department of Health, we have been at the forefront of this intervention, having successfully performed more than 1.8 million voluntary medical male circumcision procedures since the program was introduced in 2010. This, Chair, is a significant achievement, and we are confident that with the continued support of our communities, partners, as well as the Silo Samabandla, the province will surpass the 2 million mark during the next financial year. Chairperson, Ubhejane Puesqiwini is one of the people who worked hand in hand with the Department of Health when this program was initially initiated. I must also indicate that ISILO, the current SILO, Indlulamiti, yes, that's the name I'm looking for. The current CEO, Indlulamiti, has also committed that he will continue with this program because he does believe it is extremely important. We therefore call on parents, traditional leaders, faith-based organizations, and community leaders and young men to reject misinformation, seek accurate health information, and continue supporting this life-saving intervention. Let us support it as part of our collective effort to end HIV as a public health threat. Chairperson, on TB, our fight against TB remains a priority. We are strengthening early detection of TB through expanded community screening and the deployment of mobile digital X-ray units and the Stop TB in Schools program, among other interventions. Our Stop TB in Schools program continues to deliver encouraging results. To date, nearly 140,000 learners and community members have received TB and health education, while more than 101,000 learners have been screened for TB. Of these, more than 10,500 learners underwent TB testing, with 144 children diagnosed and immediately started on treatment. The program also extends into households. Through contact tracing, community health workers screened family members of affected learners, testing more than 1,700 relatives and identifying about 53 additional TB cases, all of whom were initiated on treatment. This approach is helping us detect TB earlier, break the chain of transmission, and protect entire families. Chairperson, the province currently has 8 mobile digital X-ray units operating across eThekwini, Ugu, King Cetshwayo, Ilembe, Herikwala, Zululand, and Umzinyathi districts. These units have significantly strengthened our capacity to detect TB and other chest conditions closer to where people live. To further expand these services, 2 additional mobile digital X-ray units have been procured for Uthugela and Umgungundlovu districts. In the next financial year, we will procure more digital X-rays for Amajuba and Umkhanyakude districts. Chairperson, on women's health, improving the health and well-being of women remains one of our highest priorities. We continue to strengthen integrated services that support women throughout every stage of life, from adolescent and motherhood to healthy aging. Through community outreach campaigns across all 11 districts, we are expanding access to sexual and reproductive health services. We are doing this while creating greater awareness about teenage pregnancy, mental health, HIV prevention, breastfeeding, and family planning. These interventions empower women and young people to make informed decisions about their health. We are also strengthening our fight against breast cancer and cervical cancer through expanded screening and early treatment. In fact, as the KwaZulu-Natal Department of Health, we are continuing to lead the country in HPV testing, having screened more than 252,000 women, which is more than any other province. Women who test positive for HPV are referred for prompt treatment, helping to prevent cervical cancer before it develops. Our commitment to young people continues to grow. The province now has 360 youth zones, 263 youth care clubs, and 100 groundbreakers. These facilities provide youth-friendly sexual and reproductive health services, HIV prevention and treatment, mental health support, substance abuse intervention, and other wellness programs. They do so in a safe, stigma-free environment. Chairperson, the health of mothers is one of the clearest measures of the strength of our health system. Every healthy pregnancy and every safe delivery is an investment in the future of KwaZulu-Natal. This is why we continue encouraging all pregnant women to book for antenatal care before 12 weeks of pregnancy. Early booking allows our healthcare workers to identify complications sooner, provide timely treatment, and improve outcomes for both mother and baby. We continue strengthening emergency obstetric services and improving referral systems to reduce preventable maternal deaths. Our commitment is simple, Chair. No woman should lose her life while giving birth. Chairperson, reducing the department's medical legal liability remains one of our key priorities. as every rand spent on avoidable litigation is a rand that cannot be invested in patient care. We have therefore strengthened our dedicated medical legal unit to provide focused leadership, strengthen oversight, and improve the management of medical legal matters across the department. We are also exploring the utilization of alternative dispute resolution to resolve appropriate matters more efficiently while reducing lengthy and costly litigation. At the same time, we have launched investigations into suspected irregularities relating to payments made by the department to purported claimants. Cases have already been referred to the Legal Practice Council for investigation where there is evidence of possible professional misconduct and collusion between legal practitioners and some of the health staff. We have also initiated investigations into funds previously disbursed by the Department of Health with the aim of recovering public monies where these funds were found, or where these funds are found to have been utilized improperly or improperly paid. During the 25-26 financial year, our interventions also generated savings of more than 201 million rands through negotiated settlement and improved litigation management. We remain committed to strengthening governance, protecting public resources, and ensuring that more funding is directed towards delivering quality health care to the people of KwaZulu-Natal. Chair, we continue to strengthen our forensic and gender-based violence response infrastructure. Progress is being made on the refurbishment of the Herigwala Tutuzela Center, the construction of the Otobotini Tutuzela Care Center, while the Matateni Tutuzela Center has been built and is already functioning, and we are just awaiting an official opening with the Minister of Justice. We are very proud of that program, of those facilities, Chairperson. They are quite beautiful and very effective. Construction of the new medical legal mortuary in Vryheid is progressing through the design phase, while a new mortuary for Umkanyagute has been prioritized in Umtubatuba, where a suitable site has already been secured. On EMS, Honorable Chairperson, strengthening our EMS remains one of our highest priorities. In December 2025, we unveiled...
MEC, you can take from your responding minutes.
Thank you very much, Chair. I was saying, Chair, in December 2024, we unveiled 44 brand new ambulances, which significantly boosted our emergency response capacity and improved access to life-saving care across the province.
So
we are now...
MEC, you have been allocated 20 minutes. So how many minutes do you
how many do I need?
Take?
5, Chair.
5?
Yes.
Okay.
Oglola lock. Ngithi beglola lock indaba yama minutes. Okay. Chairperson, by reprioritizing the fleet management budget, we are planning to procure an additional 50 ambulances, although we are looking at getting more than that, and that we will report to the portfolio committee once we've been able to reprioritize properly. But right now, we have found funds for 50 ambulances during this financial year. This will strengthen ambulance availability, reduce response times, and ensure that more communities receive emergency medical care where they need it the most. Chairperson, we've got a program that we implemented last year. It's called Roadside Assistance Program, which continues to deliver excellent value for money. We have appointed 12 artisans, mechanics, and procured 11 fully equipped road assistance vehicles to provide rapid on-site mechanical support across the province. These vehicles have since responded to thousands of vehicle-related incidents. This has enabled many vehicles requiring minor repairs to be repaired on site and returned to service immediately. It has also reduced vehicle downtime, lowered maintenance costs, and improved staff safety, and ensured greater fleet availability in support of uninterrupted healthcare service delivery. We will soon officially launch this program because the past year was for us to ensure that we understand how it operates and make sure that it operates properly. So we will soon be launching the program, which has been operational for a year, as I have said. Chairperson, as I bring my remarks to a close, I wish to acknowledge the many individuals and organizations who continue to partner with us in our quest to improve the health of people of KwaZulu-Natal. Your support, expertise, and commitment make it possible for us to reach more communities and deliver better health outcomes. To our senior management team, led by our head of department, Mrs. Penny Msimango, siyabonga kakhulu HOD for your leadership, dedication, and all the countless hours you invest in ensuring that our department continues to fulfill its mandate. Dr. Muji, CFO, we really appreciate the work done by all of you. I also extend my appreciation to every employee of the KwaZulu-Natal Department of Health, whether you serve in our hospitals, clinics, emergency medical services, laboratories, offices, or support services. You are the heartbeat of our health system. I also thank everyone who contributed to the preparation of this budget speech, led by Mrs. Nkosi and Mr. Mapisa. To the people of KwaZulu-Natal, thank you for believing in our vision of a healthier province. Every time you choose a healthier lifestyle, go for a health screening. Know your status, adhere to treatment, or seek medical care without delay. You become an active partner in building a stronger health system. We also thank all of you who've engaged constructively with us on social media. We truly value your input. Together, we can make KwaZulu-Natal a province where everyone has the opportunity to live longer and a healthier life. Once again, Asibe Healthy KZN. Finally, Chair, I wish to thank my family, my parents, my siblings, my children, my better half, uMadlogovu, siyabonga kakhulu Ntusi Enkomo. Ngibonga kakhulu nge-support that the family is providing to me continuously. Chairperson, I thus present to you the 2026-2027 budget as follows. Program 1, 1.3 billion rands. Program 2, which is District Health Services, 30.8 billion rands. Program 3, Emergency Medical Services, 1.9 billion rands. Program 4, Provincial Hospital Services, 15.1 billion rands. Program 5, Central Services, 6.9 billion rands. Program 6, Health Sciences and Training, 1.5 billion rands. Program 7, Healthcare Support Services, 504 million rands. Program 8, Chair, Health Facilities Management, 1.9 billion rands, with a total of 60.2 billion rands. Ngiyabonga kakhulu Sihlalo.
Thank you, Honorable MEC.